everyone. This is Dr. Khan, Executive Plastic Surgery. It's a pleasure to be on and to discuss with you the many aspects of plastic surgery. And this time around, I'm going to go ahead and discuss with what is, plastic surgery urgent care or acute plastic surgery care, if you will. This is where the many times where you need urgent plastic surgery intervention, and these are the many, I use the word thousands of cases, scenarios where someone, for example, fell off a bunk bed, a small kid, and has a laceration on the cheek. Someone had their finger stuck basically in the door hinge, if you will, and had a avulsion of the nail. Someone who had a laceration, be it acute one on the hand or on the face or the lip or the nose or the ear. The young gentleman who was launching his boat, and when he made the turn, his ear hit the side. Someone who was cutting the pumpkin with their knife, and this young gentleman cut his hand accidentally, and now you have damage to the vital structures such as the nerves of the hand. You have a dog bite to the thigh, like I saw a couple days ago. You have patients with no insurance, for example, and they have a lesion on the nose or the eyes, around the eyes, that is suggestive of basal cell cancer. You have a injury that occurred, for example, you have a complex laceration, a degloving type of an injury on someone who's on blood thinners. When you go to the emergency room, you get essentially treated and taken care of by an emergency room doctor and not a plastic surgeon. And essentially a Band-Aid is applied, if you will, the sutures, the nylon sutures are applied, and ultimately you're referred to what is the plastic surgeon. Now, by the time you make the appointment and you call, it would be a day or two or three later if you're lucky, or maybe the following week. And now you find in what is the world best healthcare system, there is a lag phase from the time of the injury that occurs to the time where the treatment is ultimately applied. So in my practice, I am introducing what is the plastic surgery urgent care, where if you have an injury and you have a laceration complex to the face, or a car accident where you had a bad cut, for example, to the hand, to any part of the body, we here at Executive Plastic Surgery will be offering you relief right away. So you skip the emergency room and then you come and see us directly. Now, one of the major very important points to make here is that you must be cleared from a trauma perspective, because this is going to be essentially an isolated injury, isolated laceration. There are times where I've seen a dog bite to the head and the canine teeth actually embed within the skull. That patient needs a trauma workup at the emergency room, for example. Or an injury where you have a hand that ended up in a blender, and now the nerves and the hands, and there is a bad fracture, you have to get an x-ray and managed from an acute trauma perspective. But if you have cases where you have an acute injury, a complex laceration, or you have a mass or high deductible, no insurance, and you want to skip the emergency room, you call my office directly and you come straight to us. And this is where you get literally being treated like the president of the US, if you will, meaning you get seen by the plastic surgery. And this is where fingertip amputations, for example, they need to be reattached. The sooner the better, within the first hour. This is where you have an avulsion injury, for example, a dog bite that occurred to the face, and now you have an avulsion of the skin that needs to be reapplied, because once it dries up, the next day it is we have lost the time and the opportunity for better aesthetic results. And ultimately, what this translates to is less pain, better aesthetics, preservation of function, better results, faster return to work, or if you're a student, faster return to your daily activities, minus the hurt and the misery of prolonging this process of taking a pit stop at the emergency room and then ultimately being referred to the plastic surgeon. And so this is a service that we are offering, and this is a self-pay service where you get seen, relatively speaking, very fast in a very expedited manner, preferably the same day, if not the very next day, so you get the world-class care by a board-certified plastic surgeon within hours of having the injury and getting the best possible results. In my practice, I've repaired a lot of nerves that have been cut, for example, on the hand, and where a patient has a sensation loss. This requires microsurgical intervention, and we have access directly to the operating room, which is upstairs, which is a board-certified facility, which is a certified facility, the Quad A certified facility. So we see you in the clinic downstairs on the first floor, and then we emergently, depending on the time of the day, be it later in the day or the very next morning, we take you to the operating room upstairs and then attend to that injury in a very sophisticated manner at a certified surgical facility with the right equipment, the right mindset, just like you would had you been a VIP patient. So hopefully you found this informative. I'm going to go ahead and discuss some cases so that you'll be able to better understand the process. You can go to our website, executiveplasticsurgeon.com, and you will see a lot of options for many other patients, for example, who have carpal tunnel, and they have an EMG proven diagnosis, or they have, for example, sign symptoms. We will direct you to someone who will be able to offer the EMG, for example, and then we can do elective carpal tunnel surgery at a fixed defined time, all at the convenience, be it under local or under local plus sedation, so that you get the relief you need minus the exaggerated dollars that you would have had to incur had your surgery done at the hospital. So we'll go ahead and talk about the many other scenarios, situations, patients with old scars, skin lesions, skin masses, wherever they may be, so that you get ultimately the treatment that you need at a state-of-the-art facility. And hopefully you have find this informative, and we will continue to discuss this tomorrow as we continue our journey to provide excellence to our patients, whoever they may be, and any questions I can answer. So certainly please do get them ready. This is Dr. Khan, Executive